Medical professionals of Reddit, what's the funniest thing a patient has said under anesthesia? Best comments. Yelling for his brother, then whispering loudly to him, check to see if I still have my D*CK. I think they took my D*CK, then proceeded to flash the whole room. Better safe than sorry. Was recovering a patient after surgery who got ketamine, which has a known side effect of making you super emotional. When she woke up, she started catcalling me, telling me how attractive I was. Then she got worked up because she was thirsty, so I told her I could get her ice chips. As I am getting her ice chips, she starts to go, I hate to see you leave but love to see you go. As I disappear to get her some ice chips, she starts crying real tears that she scared me off and how sorry she was. Way to go, heartbreaker. Man, I know that's just the anesthetics, but I would have taken that as a confident boost for the day. Not a doctor, but I was told by my dentist that when he was prepping me to remove my wisdom teeth, I asked him why he became a dentist. I vaguely remember him telling me a story about how when he was a preteen he was at a local pool, running around when he slipped and smashed his chin on concrete and shattered some of his teeth. Ouch. He was amazed at how well they reconstructed his teeth that he decided to go into dentistry. Apparently, I then looked this man in the eyes and said, well, that's a stupid fucking reason to become a dentist. Sorry, Dr. J. Had a patient come into recovery after surgery. She farted so long and loud the entire 20-bed unit heard her. Then she said, I was trying to clear my throat, excuse me. And I want a vanilla latte, I got a headache. As medical professionals, we had to hold in the laughter, but that didn't stop patients from turning into hyenas. Ha ha ha, okay, I don't know how you guys didn't laugh. We are professionals. We are good at what we do. Including saving our laughter for later during our lunch break. Team preparing to salsa dance. Stand back everybody. There's nothing you can do to stop me. Somebody stop me. Narrator, nobody stopped her. I just had a bowel resection and was hopped up on morphine. My divorced parents hadn't sat in a room that long together in forever. My sister, uncomfortably quiet between them, tells me my junk is hanging out of my hospital gown, and I say, if my balls are hanging out. That makes this a ball gown. Really helped with the tension. Ha ha, this is one of the funniest in the thread for me. Agreed. Simple, punny, and effective. I like it. 18-year-old girl recognized the male anesthesiologist from Tinder last week and accused him multiple times of not showing up to their agreed date while randomly falling half asleep in between. As we put her back in bed, she mumbled that she is not even mad, just generally disappointed in men and that she still thinks he's pretty. Literally one of my worst nightmares. To be the girl or the anesthesiologist. The most memorable funny one was a guy who sat bolt upright, mime rolling a cigarette and tuck it behind his ear, saving it for Ron. When I'll asked what he was doing, anesthesia can be a wild trip. The kids will always scream when they wake up. I woke up from my hysterectomy screaming in pain and begging them to make it stop. The nurse was freaked out. She was desperately trying to get meds into my IV as fast as she could. Only for me to have a hives response all over my face. I must be a kid at heart. Had a large skin graft and woke up absolutely consumed by pain. It was horrible. My parent was so freaked out. I always thought the nurse must have woken me up too early. I was so riddled with pain I became extremely apologetic, telling my parents I'm sorry for having cancer and this and that. It scared the living fuck out of me and my parents. To this day I've never felt pain like that before. Absolutely horrible. I can only imagine what other kids in my ward were thinking. That experience haunts me. I swear I have PTSD cause any time someone has mentioned surgery shake. I mean honestly, if you're having long-term effects from it you might have PTSD. In which case, speaking from experience as someone with diagnosed medical-related PTSD, a good trauma therapist is a world of help. Fuck, poor you and poor nurse. That is a very important comma placement. Why do the kids always scream? When I woke up from anesthesia as a kid I screamed bloody murder. I always thought it was because I had felt the entire surgery as if I had no painkillers, like that movie Awake, and just didn't remember. I've been scared to go under ever since. The state of mind you have when going under is multiplied when you wake up. So if you're nervous going under, you can wake up terrified and hysterical. Can confirm, 20-year-old male here, had my wisdom teeth out this year in February, went under with anesthesia. When I woke up I was in my bed, remembering nothing after got put under. My mom was the designated driver and said I was silent and didn't blink at all. After I woke up, she put me to bed, and when I woke up I started freaking out and sobbing hysterically, and she had to basically kick the door down and comfort me. Scary shit. Yeah, when I got my wisdom teeth taken out, around 2005, they told me Elle kept ripping out my gauze, and when I got into the car I started crying and then just straight up vomited blood all over. I remember before I went out cold, they said, count down from 99, and I thought, PSH, that's no big deal, liminal see you at 0, 99, 9ZZ. In the early days of my surgical training, there was a day that I was assigned to a colonoscopy list. Standard practice is to premedicate patients in the anesthetic bay if required, particularly if they are a bit anxious about the procedure. I was clerking one of the patients in the anesthetic bay, going through consent and the usual pre-op routine, when I noticed that she was giving me these weird sidelong glances and that her eyes would dart away every time I tried to make eye contact with her. She was also extremely fidgety and was stammering a lot in her responses to my questions. I kind of shrugged it off as preoperative nervousness and let the anesthetist do his business. Fast forward 10 minutes and I'm standing behind her, she, curled up into the fetal position with her ass hanging out and I, colonoscope in hand. As the propofol starts rushing through her veins, she turns right around, grips my forearm and stares up at me with a dreamy look on her face and goes, "You know what, Doc? I bet you kill it with the ladies." A moment later she was asleep and I was checking her colon for polyps. A moment later she was asleep and I was checking her colon for polyps. With the colonoscope. Oh, sure. Tinder dates get weirder and weirder. Or yeah girl, I wanna check your colon for polyps. Yep, gonna use that line on my wife tonight. I'm a consultant anesthetist, UK, and there are loads. Often declarations of love from the patient as the drugs are kicking in. My all-time favorite is a 40-something guy. A few years ago he needed a testicle removing for cancer. He'd never had an anesthetic before and was super nervous, to the point of barely saying anything to anyone. As the drugs started to kick in, we realized someone was quietly singing. It was the patient. Hitler has only got one ball. Göring has two but very small. Himmler is rather similar, but poor old Goebbels has no balls at all. Anesthesiologist here. During recovery from general anesthesia, I called one of my patients by his full name in a loud voice. He opened his eyes, suddenly jumped upright and sit on the bed, and he said something. Sir, yes sir. He was under military service at that time. General anesthesia. For major surgery. Young girl after a root canal said, "Where are my dentures?" Damn, how long was she under? Not more than 30 minutes, but she took a bit to recover. When I got my wisdom teeth removed I was babbling utter nonsense while waking up. In my mind I was fully aware of what I wanted to say, which was, "Can I have my wisdom teeth?" But it was coming out like, JJ. Fortunately my partner is used to my nonsense because I tend to do it when waking up from any deep sleep, and translated for me, she wants her wisdom teeth. The surgeon said no. I just had a double root canal and I wish they would have just knocked me out. The very first time Elle was under I was in 3rd grade and was relatively scared. What kept me brave was the promise of Burger King breakfast afterwards. It was an early morning procedure that required fasting and I rarely got fast food. They ended up running behind that day, so it was up in the air if I would wake up and get out in time to get my breakfast, which ended at 10. The first words out of my mouth were, "What time is it?" When my mom informed me it was already about 9:30. I tried to get out of bed and nearly ripped out my IV in the process. When she tried to tell me that we would be late and I could get it another day, promptly burst into tears. Edit, I did get my Burger King a different day. Thank you all for your concern. This makes me so sad for you. Did you eventually get your Burger King breakfast? One of the times I had an endoscopy when I was around 10 years old, I woke up pretty groggy and naturally with a dry and sore throat. I asked the nurse for water, but she said I couldn't have any yet. She left the room, so I started climbing over the raised sides of the bed to get some. She walks back in with me almost at the point of no return, also the point immediately preceding the point of face planting the floor, as I was in no state to be balancing or climbing, freaks out screaming, "What are you doing?" So I'll say something along the lines of getting some water, and she relents and goes and gets me some. Did you get it? This woman undergoing C-section under spinal anesthesia plus ketamine said, "Show my baby first to my brother-in-law, he deserves to see her first." I sometimes wonder what happened to her marriage after that. Oh no. Here's Wonderwall. Because maybe. I want to believe it was something like her husband being infertile and the bill donating the sperm for in vitro, or helping him with money, so they were now able to afford a kid, or stuff like that. Don't try to change my mind. You know what, I prefer to believe that answer. It could also have just been a situation of her being totally loopy with the drugs, and her confused mind thinking, who sees the baby first, who do I know, brother-in-law. Yeah, that sounds about right. After I woke up from general anesthesia, I saw the table in front of me had a sticker on it that said, "Made in Lower," and I promptly started crying and saying, "How did I get to Lower? Pipe. Don't want to be in Lower." My mom had to explain the table was just from Lower. I mean, ketamine is a dissociative, so it makes things all nonsensical. Well, as an intern in the labor ward, had a young girl brought in to deliver. Looking back, the family with her were behaving tense and strained. Sent him off and started taking her personal history. At the marital and conception history part, she starts shedding tears, and then gasps out her story. Her sister was pregnant, and she went to her house to help out. Brother-in-law used this time to seduce, coerce her, and thus the pregnancy, which she tried to hide till it was too late. People suck. Woman woke up from surgery and said to her husband, "David, that alarm clock has a nose and it's running. Wipe it."